The state of genetic testing for ovarian cancer is now such that about 1 in every 10 to 12 women who has ovarian cancer has a hereditary cause of the ovarian cancer. And because that is above our testing threshold, we actually recommend that all women with ovarian cancer consider seeing a genetic counselor. For someone who's already had cancer, genetic testing can help us determine their risk of developing another cancer. It also has implications for their relatives, because genetics is a family business. It doesn't just affect the patient in the office. And the third thing that's emerging, but I think interesting and fascinating, is sometimes it can guide treatment. So there are new medications that can be targeted to BRCA populations or to tumors that have what we call BRCA nests. And in some ways, having a BRCA mutation in, for instance, ovarian cancer might allow women to qualify for clinical trials for some of these new agents that provide targeted therapy to them. When we consider BRCA testing in a high-risk family, we typically will see 1 or 2 family members in our office and collect a very detailed three-generation pedigree. And that pedigree will include all relatives who've had cancer and haven't had cancer, their ages of diagnosis, their ages of death. We usually try to get birth certificates and medical records to confirm the family history. The family history is really important because it helps us to interpret test results. And then once we have a very detailed pedigree, we provide education and we let folks know what the test results will mean, whether it's positive, negative, or whether it has an uncertain test result. And then if people choose to go ahead and get testing, they will get a blood draw. And there's one lab in the United States called Myriad Genetics where we send all of the BRCA test results. It's in Salt Lake City, Utah. And the reason we send the test results to that one place is because they have a patent on the testing. And it takes about 2 to 4 weeks for the results to come back. We like to give the results in person. So our protocol is to see the patient and, if possible, family members as well to disclose test results in person. And in some ways, we consider the family as our patient. When we see one person in the office, we envision sisters, aunts, uncles, nieces, all of their relatives as well. There are several myths in the BRCA genetic testing world that we like to dispel, and one that you alluded to is that, can BRCA mutations come from both sides of the family? And BRCA mutations can come equally from the maternal and paternal side. Some people think that breast cancer is only inherited from the maternal side, and that's not true. Men have as much of a likelihood of carrying a BRCA mutation if they come from a BRCA family as women, but in men their chances of breast cancer aren't as high and they don't have the chance of ovarian cancer, so sometimes it hides when it's on the paternal side. So a myth we like to dispel is that it is important to look at the paternal family history as well. Another myth that we like to dispel is in families that might not be big, they might not have a lot of relatives, a lot of people will say, well, gosh, there's no cancer in my family. Is it worth thinking about genetic testing? And for people who come from small families or from families that don't, for instance, have a lot of women, it doesn't necessarily matter that there might not be a lot of cancer in the family. We still, if someone meets criteria for genetic testing, we still would consider testing no matter what the exact family history is. For instance, if a woman who's very young is diagnosed with breast cancer,